Hi, my name is Bryan Petrow. I'd like to talk to you a little bit about an IPS patient case. The patient presents to the emergency room with altered mental status and confusion, and also vomiting blood. The patient is 62 years old, has a 10-year history of alcohol abuse, and has been diagnosed with cirrhosis of the liver 6 months ago. He was brought in to the ER by his girlfriend, and she claims that he has been binging on liquor for 6 months. She found him in a confused and altered mental state on the couch, and he currently has brownish particles in his sputum. The patient has a history of substance abuse, alcoholism, hypertension, depression, and GERD, as well as a few other factors. As far as vital signs are concerned, his blood pressure is 145 over 88, his pulse is 110 beats per minute, his respiration is 12 breaths per minute, his temperature is 38.2 Celsius, his weight is 100 kilograms, and his height is 6 foot 1 inch. As far as relevant labs are concerned, his bilirubin is 3.2 milligrams per deciliter, his INR is 2.2, his hemoglobin is 7.6, and his serum ammonia is 120 micrograms per deciliter. So how are we going to help this patient out? Based on his child pug scale, he's got C level liver failure, so he needs some urgent support. So we are going to give him rifaximin 550 milligrams orally twice a day. We're going to give him lactulose. Lactulose is going to be given about 20 to 30 grams 3 or 4 times a day. This will help lower his ammonia load. As far as his mental condition is concerned, we should probably give him some thiamine, maybe IV, in order to rule out and mitigate possible Wernicke-Korsakoff syndrome. We should do away with citalopram. This will be aggravating the root cause. As far as looking into ascites, patients should be on furosemide and spironolactone. Furosemide should be dosed 40 milligrams IV bolus, and spironolactone should be dosed 100 milligrams orally every day. There has been talk of physicians wanting to initiate fresh frozen plasma because of his hemoglobin being so low. I would opt for whole blood for this patient, trying to get some protein in his blood fluids in order to draw water out. That would be a high recommendation. It would be doing 2 things at once. As far as varices go, metoprolol is really a grade A recommendation, but because of his liver problems, let's give it tartrate instead of succinate 50 milligrams. Cefotaxime is a good antibiotic choice, and it's definitely indicated for those with esophageal varices. I would give 1 gram every 12 hours. I would discontinue acetaminophen and ibuprofen. Those would really aggravate his liver furthermore. And give some opiates, maybe 5 milligrams orally, oxycodone if he has unbearable pain, and monitor his pain every 24 hours. Be on the lookout for respiratory depression, and put the patient on a docusate senna bowel regimen. Alright, so thanks for taking the time to watch my video. Goodbye.